Okay, I'm Dr. Deuk, and you can see it's getting close to Halloween time because I have things hanging in my face. We just finished a Deuk laser disc repair, L4-5 on this gentleman, left side approach, and he had been suffering with back pain for quite some time. I'm going to let him tell you a little bit more about it, but he's getting ready to go home. We're about 30 minutes after surgery. So what kind of problems are you having with your back before you came here?
Well, many years ago, I took a good fall, and I've been living with the pain for 25 years or so. It's been a very, up and down time where, sleeping is just almost impossible at times. Movement, sports, it always, comes to a quick end. Anything that I attempt like that. I've been living with it because it comes and goes, but this time it really stuck around, so I thought, enough. I'm going to come in and do something about it. While I haven't been offered any other type of procedures, I really haven't looked, but just seeing some of the testimonials from other people, and in fact a dear friend of mine, I felt inclined to get in here immediately and see what we can do. And the results are just fantastic. I'm just out of surgery. I feel no pain in my spine and in the area where it did occur. I feel a slight pain in the incision area, but that's minuscule. So I'm overall, at this point, very pleased.
Well, you made my job easy because I didn't have to ask you a bunch of questions. But obviously, you've had the pain for a long time. You know that pain. It's part of your everyday routine, and you don't feel it anymore. We didn't give you pain medicine. You're not on pain medicine right now. We gave you a sedative called propofol. It's not a painkiller. It just puts you to sleep. And here you are with some incisional pain and discomfort because we had to cut you to go in.
Of course.
But that pain you had in your lower back before surgery is...
I can't feel it.
It's gone.
Yeah, I can't feel it. Yeah.
All right. And where are you headed now?
I'm going home.
Home, right?
I'm going home.
So like 30
I'm going to get
minutes,
some lunch and go home.
Go get lunch and go home. It's wonderful. You get your back surgery done, you get your back fixed, and you get to go home within 30 minutes. If you had done this at the hospital with a fusion, which would be an alternative, you'd still be in the hospital. If you'd gone elsewhere, you'd be in there for about a week with screws and rods. So it's a wonderful opportunity for you. Anything else you want to say to people before we set you home?
I want to add that the staff here, all you guys are amazing. Applaud to you guys. You're brilliant. Absolutely brilliant.
Thank you.
Yep.
Yeah, well, thank you, not myself. I'm thanking on behalf of the staff. So, yeah, they do a great
And you,
job.
obviously. That goes without saying, but these guys get the recognition. Yeah.
Good luck.
Thank you very much.
Enjoy your new lease on life. All
Absolutely.
right?
Thank you very much.
Enjoy it pain-free.
Thank you.